Hey, it's me, Bad Bee, I'm back. So I thought I would do a video on common terms that you might encounter during breast cancer treatment, acronyms that you might encounter during breast cancer treatment. So the first one would be Breastie. So Breastie means bestie, but with breasts. So your breast cancer friends, basically. I use this one all the time. Heaps of my breasties are now just like my really good friends. It's a really nice one. These next few terms refer to the pre-cancer treatment stage. So if they suspect you have breast cancer, then they're going to do a few checks on you. So the first one would be a SLNB, which is a core needle biopsy. Now this one I actually found really traumatizing. I talk about it in my diagnosis video, up here or here, I can't tell. In Japan, when I had my biopsy done, they did a core needle biopsy initially, which is this massive needle, and it's really intimidating looking, really intense. But that's not the difficult part. They will numb you and give you local anesthetic when they do the core needle biopsy. The horrible part is actually the sound that this device makes. It's a needle that they will insert into your tumor and it will let off a huge bang when it takes a chunk out of your tumor, so they can take away that part for tissue sampling to determine whether you have cancer or not. Another type of biopsy they're going to do is an FNA. So it's fine needle aspiration. Anyway, they did this also in Japan when I don't know where, I got to find the video, when they wanted to check if I had cancer which had metastasized to my lymph nodes. They did a fine needle aspiration. So it's a lot more doable, I feel, than the core needle biopsy. I mean, look, you're going to have to do both or either. If your doctor suspects you might have breast cancer, I'm sorry. But this one, it's also a giant needle, but mostly it's just really long, and the barrel part of the needle, the plastic bit, that's really big. But otherwise, it's not a big fat needle. I didn't actually feel pain. It wasn't painful at all. It was more knowing that this massive needle was going into my armpit without any type of anesthetic. The doctor was like, haha, we're not going to do any anesthetic. And I was like, what? I hate pain. And they're like, don't worry, you'll be fine. And I was like, have you had this injection? And they said, oh no, but it's fine. Oh, I hate when people say that. If you haven't been through it, don't tell me it's going to be fine. I lay down and they used an ultrasound as well. And the doctor would insert the needle into my underarm and jiggle my underarm, I think, to stop me from feeling pain, which I really appreciated. But yeah, that's all I felt, the jiggling. The next few terms refer to breast cancer surgery. So BMX means bilateral mastectomy, which means removal of both breasts. It's interchangeable with DMX, which is double mastectomy. Again, amputation of your breasts or removal of all your breast tissue. Neo-adjuvant is the type of chemotherapy and cancer treatment you get before you have surgery. Adjuvant treatment is the type of chemotherapy or immunotherapy or cancer treatment you receive after you've had surgery. The next few terms refer to neoadjuvant chemo and also immunotherapies. We're going to start with the chemos. When I was in Japan, I was on Taxol, the regular name for paclitaxel. I also had to do PHESGO, which is Herceptin, which is trastuzumab, and PERJETA, which is pertuzumab. So PHESGO, it stands for pertuzumab, Herceptin, and hyaluronidase. So I had 3 of those for neoadjuvant treatment, and now for adjuvant treatment, immunotherapy, I have 14 Herceptins or trastuzumabs. Another funny one, I think I found it on the breast cancer subreddit. One person was referring to PERJETA as PUJETA, because it sucks. It can give you horrible side effects. I talked about how I was on paclitaxel or Taxol. Another type of chemo I was on is commonly known as the red devil. Now, it's called the red devil firstly because of its color. It's super red, looks like red cordial, but also it wreaks havoc on your system. It gives you horrible side effects. AC is the shortened acronym for the red devil, and AC stands for adriamycin and cyclophosphamide, or it can also be called doxorubicin. Now, it was an intense chemo, and I'm really sorry if you have to go through it, but know that it's super strong. and hopefully it'll work for you. The next chemo regimen that you might come across is TCHP. So this stands for Taxol, carboplatin, Herceptin, and Perjeta. So I was only on the HP part of the TCHP. Another term you might encounter while undertaking neo-adjuvant chemotherapy is DEX. So DEX is short for dexamethasone, which is a type of steroid that they will give you during chemo to prevent or keep nausea at bay. Now, it does work. I was super grateful. I was rarely nauseous, and I think it was only towards the end of AC that I got really nauseous. But this dexamethasone, or DEX, really comes with its own set of side effects. So you're super duper constipated, which if you've gone through treatment, you might get diarrhea or you might be constipated or both. And I found diarrhea way easier to deal with than constipation. Like, I cried when I was constipated. It hurts so much. Not being able to poop is the worst. It also disrupts your sleep. A lot of people talk about the energy rush that you feel from DEX. So it keeps you up at night, it gives you insomnia, but you'll have so much energy that you'll like clean your whole house. Yeah, it's kind of funny, but it's not. The next term you might encounter, and actually, you know, you'll get it during chemo and even after chemo, but chemo brain. It's similar to baby brain or pregnancy brain, but it's related to chemotherapy. So chemotherapy destroys every cell in your system to try and fight off this cancer. And obviously your brain is going to be affected. You might have brain fog, you'll forget things, you might find it hard to recall words. I get all of this, and that's why I have so many cuts in my videos, because a lot of it I'm just sitting there being like, what? Or I say the wrong thing, or I even mispronounce things. But hopefully now that I've finished chemo, it will get better, and I think chemo brain does go away. Now, another term you might encounter while on breast cancer treatment is flush. So when you have your chemo or your immunotherapy, they're going to do a saline flush through your system afterwards to try and like get it out of your veins as much as possible, and also to rehydrate you, saline flushing through your system. The next term I want to talk about is PCR, which refers to a pathological complete response to chemotherapy. Now, this means the chemo did its job, it worked, there are no traces of tumor where there were tumor. So I was told I achieved PCR twice. Once after my sentinel lymph node biopsy, they're like, oh, it looks like you've had a pathological complete response to chemo, which means the chemo killed all of the tumor and there are no traces of tumor left. Now, after my bilateral mastectomy, they take out all your breast tissue and then they slice it and they analyze each of the slices to see where there could be cancer cells. And again, I achieved PCR, or pathological complete response to chemo, after my bilateral mastectomy too. So all they found was tumor bed, which is remnants of the tumor cells that were affected by chemotherapy. If you did not achieve PCR, don't worry, because I don't know how many percent of people actually achieve PCR, but if you don't, that's okay. So if I didn't achieve PCR, then I wouldn't be on regular trastuzumab. I would be on Kadcyla, which is trastuzumab emtansine. Now, this one is a little bit like chemo, but not as intense. So your hair grows back and everything, and you don't feel as terrible, but it kind of works in between a regular chemo and a regular immunotherapy. So I have friends that are on Kadcyla. Now, the next term I want to talk about is survivorship. Survivorship is the time after you finish cancer treatment and you're now a cancer survivor. So you're working on getting your life back, living your best life, and just trying to find your new normal after cancer treatment. Another term that I really like is survivor thriver. So you're not just a cancer survivor, you're a cancer thriver. You've had cancer, okay, it sucked, but now you've finished all your treatment and you're living your best life and not just surviving. I really resonate with this term because having breast cancer at such a young age and having to go through treatment, it showed me how fleeting and how short life really is, and how much I really want to enjoy life now. So that's why I'm still documenting and pivoted niches. I know you're not meant to. I really want to document my life after cancer because life's too short for me to not enjoy every second of it. Those are all the common breast cancer terms and acronyms that I encountered during treatment. If you have encountered them, let me know in the comments. If you haven't encountered them, let me know in the comments. If you have different terms that you'd like me to cover, then I'm happy to do a follow-up video to this. Also, let me know in the comments. Again, I don't want to be this person, but like and subscribe. Yeah, stay tuned for more Survivor Thriver things.